Okay, hi class. Chapter 19. Now we're talking about bacterial disease of human. We did viruses in the last chapter. Now we'll talk about some bacterial diseases. So after reading this chapter, you should be able to identify several airborne bacterial diseases, including tuberculosis and disease prevention strategies. Explain the difference between a bacterial intoxication and a bacterial infection, and identify several foodborne and waterborne bacterial diseases. Compare and contrast soil-borne bacterial diseases, anthrax and tetanus. Identify several arthropod-borne bacterial diseases and the insects that transmit the bacterial pathogen. Distinguish between the three major sexually transmitted diseases. Identify bacterial diseases associated with the skin, the oral cavity, and the urinary tract. Explain what healthcare associated infections are and identify several HAIs. Okay, so syphilis, uh, originally known as the Great Pox, and one of the very first uses of penicillin was on syphilis. Um, and there are multiple stages of syphilis. The tertiary syphilis is the most serious, and it's generally associated with malformations of the body and of the mind. You basically can go insane from syphilis. And one of the interesting things here is that um, syphilis um, illustrates the role of microbes in activities beyond the infection and diseases. Um, and because the body gets so disformed and the person will go insane, um, you, you're really looking at more than just the infection. You're looking at the whole body and what has gone wrong with that person if they get syphilis. And so, in a way, penicillin was uh, great because it knocked out, killed the bacteria that was causing the syphilis. Um, but people got a little uh, careless. They figured, oh, well, I'll be able to get rid of it because we have penicillin. Okay, some airborne diseases. And airborne diseases are pretty much the scariest because it's so easy to transmit airborne diseases, and people are pretty much constantly breathing. Okay, so one of the uh, major bacteria that are doing this is Streptococcus pyogenes, and you can have streptococcal sore throat. Signs and symptoms of this: the high fever, coughing, swollen lymph glands, and fiery red um, pharyngeal tissues. Okay, um, and Streptococcus pyogenes uh, is a nice bacteria from the bacteria point of view. And you can see it highlighted in blue in that figure. Okay, Streptococcus pyogenes can also cause scarlet fever, and you can have a skin rash um, with the other symptoms is the high fever and the coughing, and scarlet fever. Uh, in rheumatic fever, this is a streptococcal complication um, that can progress to scarring and distortion of the heart valves. Um, and this is the rheumatic fever can give you rheumatic heart disease. Diphtheria is caused by Corynebacter diphtheriae, and we definitely have a vaccine, and it's made with a toxoid, and a toxoid means that it's an form of the toxin that doesn't cause disease. Pertussis or whooping cough is caused by Bordetella pertussis. Uh, and you get a disintegration of cells and mucus accumulating in the airways. This debris causes labored breathing, uh, which is that labored breathing is how you get that whooping cough sound. This again can be prevented by a toxoid vaccination. And we are getting a reemergence of pertussis uh, because um, vaccinations are not always taken, and that we're getting less and less immunity in many parts of the world. Bacterial meningitis, uh, disease of the meninges, which is the membrane fluid that covers the brain and the spinal cord. Uh, the most severe form of this is meningococcal meningitis, and this is caused by the bacteria Neisseria meningitidis, and it's transmitted through aerosol and through sharing of utensils or cups, and is often accompanied by pounding headache, stiff neck, and numbness in the extremities. And the cells of the nasopharynx can be colonized, and will this will eventually disseminate into the meninges, um, and so you know the the nose is your primary source or place where the bacteria will colonize, but then they'll be able to go um, into other body tissues. Bacterial meningitis, um, also known as childhood meningitis, and is typically caused by Haemophilus influenzae type B, and there are vaccines available for the bacterial and the childhood meningitis. Now, meningitis A epidemics, especially prevalent in recent of sub-Saharan Africa. Um, this is generally referred to as the meningitis belt. Uh, a new meningitis A vaccine has dramatic success in disease elimination. Tuberculosis. Tuberculosis is caused by the bacteria Mycobacterium tuberculosis, uh, and you again breathe in the mycobacterium, and it will settle into the air sacs in the lungs, and then a very sort of massive infiltration of um, white blood cells come in there to try to get rid of the bacteria. Um, and when you get a chest X-ray and they're looking for uh, tuberculosis, what they're actually looking for is the white blood cells accumulating in the lungs. Uh, so you can do a test um, by taking the protein tuberculin and injecting it just under the skin, and you probably have all had um, a TB test. Um, so you put a little bit of it under the skin, and then you wait 2 days, and if you react to the protein, then the spot of the injection will turn red. If so, if you've had um, TB, then it'll turn red. If you don't have TB, then you get no skin reaction. Okay. Like I was saying, you can definitely tell if you have the TB from a chest X-ray, and again, it's the white blood cells that are filling the lungs with water that you can detect on the X-ray. Now, if you can get a sample, um, you can look for the bacteria directly, and mycobacteriums are different. I sort of in the beginning of the course said that you have gram positive and gram negatives. Um, the mycobacteriums are actually a special class, and they're called the acid fasts. And it's a different staining technique than the gram staining. And so in a gram stain, you really don't detect this kind of bacteria. But if you can do the acid fast staining, then you can tell for sure that this is that kind of bacteria. Okay. So tuberculosis has a very extensive antibiotic regime, um, and Mycobacterium tuberculosis uh, grows very, very slowly, and that gives a very high level of antibiotic resistance. Okay. And so, what is sort of the going thing right now is that you have multi-drug resistant tuberculosis or MDRB, TB. Um, and where this is really common right now is in prisons, because you can imagine that the air inside of a prison is not that is not changed very often, um, and so the bacteria get breathed out and then breathed in by the next inmate, and a lot of times these become drug resistant, um, and that in part is complicated by the fact that people don't take the drugs for as long as they're supposed to. Okay, there is a vaccine, um, and that vaccine is available in some very high risk areas of the world. And I sort of again don't wonder why prisoners don't automatically get it, but in this country, tuberculosis is fairly prominent in prisons. Legionnaire's disease. Um, this is a kind of interesting disease. Uh, the bacteria is Legionella pneumoniae, and again, a fairly recent uh, acquisition that we sort of only recently figured out what the bacteria was that caused Legionnaire's disease. Okay. Um, Legionnaire, the bacteria grows in standing water, and where it grows very well is in radiators or cooling towers that are on top of buildings. Um, and so, very often, to get good air conditioning in a building, you have a water cooler on the top of the building, and that in that water, the Legionella pneumoniae will grow quite well. Okay. Um, okay, signs and symptoms of Legionnaire's disease are high fever, a dry cough, um, and it can be a potentially fatal lung disease. Um, People, when it was first diagnosed or first discovered, definitely were dying from it. Okay. Bacterial pneumonia is a microbial disease of the bronchial tubes and the lungs. Uh, Infection usually results in significant fluid infiltration into the lungs and can be caused by a few different agents, but Streptococcus pneumoniae um, is the major player in bacterial pneumonia. Signs and symptoms of bacterial pneumonia: high fevers, sharp chest pains, difficulty breathing, and rust-colored sputum. Um, and what is happening is you're getting blood into your lungs. Um, this can be treated with antibiotics, and there are some vaccines available, but the vaccine is not sort of a general vaccine that's generally given out. It's more of a specialized vaccine. Um, Bacterial pneumonias are primarily atypical pneumonias, uh, sometimes called walking pneumonia. Uh, Not as severe as full-blown bacterial pneumonia. So there's low or no fever and no blood in the lungs. Uh, is caused by Mycoplasma pneumoniae. Okay, foodborne and waterborne bacterial diseases, gastroenteritis. Okay, gastroenteritis is simply defined as an inflammation of the stomach and intestines, most commonly seen when vomiting and diarrhea. Diseases can be caused by um, intoxication, which means you're consuming the bacterial toxin. And in the case of bacterial intoxications, you don't have to have the bacteria present, just as long as their toxin is present. Okay. An infection uh, is where you actually consume the pathogen. Uh, foodborne surveillance. Um, it really can be quite a big deal that your food be kept um, both at a proper temperature and that it's actually in good condition. Um, as you can see on the graph on the bottom on the left, you can see that Campylobacter and Salmonella are two of the biggest players in gastroenteritis. Um, things like poultry are very high in the Salmonella. Um, yeah, um, gastroenteritis. Uh, there's a role of the human microbiota. So bacteria that are normally in you and on you do play a role in getting gastroenteritis. Um, in some cases, this is just to prevent the gastroenteritis because there's so many bacteria there already. Um, you can't get new bacteria coming in. So you need all those bacteria of the microbiota, and they sort of crowd out the new pathogens that may be coming in. Um, it's getting very trendy to take probiotics. Um, and again, this will just increase the number of good bacteria in your system so that you don't get those pathogens. Okay. Um, read section 19.2 to look at the role of the bacteria in the appendix. Okay. A major foodborne disease is botulism, um, and botulism is caused by the bacteria Clostridium botulinum. And what's really important about this is that it is a spore-forming obligate anaerobe. And so when you have no oxygen present, um, the Clostridium can survive quite well. That's why it can survive very easily inside of, say, a sealed can, because inside of a can you wouldn't have any oxygen, and the Clostridium could just take over. Um, Now the toxin is produced by cells that it will end up becoming spores, and the botulism toxin is among one of the most dangerous toxins known to man. Okay, so when you get botulism, you'll have blurred vision, slurred speech, labored breathing, and a flaccid paralysis. Um, Basically, the botulism toxin is keeping you from uh, contracting muscles, and so that's why you lose your vision, and also why you get the paralysis. Um, there is an antitoxin, um, which so they've given the toxin to some very large animal. They bleed the animal and take the antibodies out, and that produces the antitoxin. Um, it can be done, but not it's not 100%. It's not the greatest way to do it. And I've already talked a bit about it, um, Botox, and it is the same toxin. So again, to keep wrinkles out of your face, you're going to put the most dangerous toxin known to man injected into your face. Um, I think it's probably worth a wrinkle or two. Okay. We can have staphylococcal food poisoning. Um, so Staphylococcus aureus would be the bacteria causing that. Uh, Symptoms are very similar to most of the major food poisoning cases: diarrhea, vomiting, and other signs of gastrointestinal distress. Salmonella, uh, caused by Salmonella species, and the sources are mainly poultry, contaminated animals, and eggs. Okay. And again, symptoms of salmonellosis are very similar to most other kinds of food poisoning. Typhoid fever is caused by Salmonella enterica serotype typhi, so that's a subtype of the Salmonella enterica. Uh, and it is transmitted by the 5 Fs. Uh, in Salmonella typhi, um, you'll have deep intestinal ulcers, bloody stools, uh, after a few days, a mounting fever, lethargy, delirium, and if left untreated, this food poisoning can be fatal. Uh, because salmonella can be treated with antibiotics, you do have a lot of antibiotic treatment for Salmonella enterica. Shigellosis, um, a dysentery um, caused by uh, Shigella sonii, and you'll have intense abdominal cramps and small volume bloody mucoid stools. So you don't go to the bathroom much, even though you have very intense cramping. Again, another toxin, in this case, this is Shigella toxin. Um, Shigella toxin is not quite as dangerous as the botulinum toxin, but still an endotoxin. Cholera is caused by Vibrio cholerae. Uh, you can have severe watery diarrhea, um, and you usually death is caused because you actually dehydrate because you lose so much volume um, in these watery diarrhea. So you almost always have to have some sort of oral rehydration therapy, um, and probably just water wouldn't be as good as something like some Gatorade. So you get the electrolytes back. Now the E. coli diarrheas, um, the Escherichia coli strains are responsible for several forms of gastroenteritis. Uh, these are generally spread by contaminated animal feces, and you might think, well, where would I get animal feces on my food? Think about it. If you have, say, a raw carrot and that carrot obviously had to be grown in a field. Um, if an animal was in the field and did its duty there in the field, um, you could very easily spread some of that fecal material onto the carrots. And so if the carrots aren't washed properly, then and you eat them raw, you could definitely be getting some of that fecal material on the carrot. Um, water supplies, if the animal contaminated a whole water supply system, you can have a problem. Um, and when you eat raw meats, um, especially something like ground meat, ground beef, um, you can have that contamination. And with something like ground beef, um, the grinding process helps uh, transmit uh, the feces, and so the butcher might not really notice that his machine is not 100% clean, and so it's very easy to have hamburger patties contaminated. Okay. Um, so in its mildest form, you have traveler's diarrhea, um, and in the traveler's diarrhea, uh, it is a diarrhea, um, but it's generally pretty short-lived and not so bad. Now, in the severe forms, um, you can have hemorrhagic, which is from E. coli 0157H7. That's what you hear on the news a lot. Um, so hemorrhagic means you're bleeding internally. Campylobacter. So campylobactosis is caused by Campylobacter jejuni, and again, a typical gastroenteritis. We can have legionnosis, which is caused by Legionella pneumoniae. Sorry, Legionella monocytosis. Um, this is transmitted by contaminated food, and again can be treated with antibiotics. Brucellosis, caused by species of Brucella, and this is usually infectious from drinking unpasteurized or raw milk products. Um, and I know there are some places in Pennsylvania that you can buy unpasteurized milk, um, but I really don't recommend it. Peptic ulcers. Um, Peptic ulcers are caused by Helicobacter pylori, and one of the really fascinating things about this bacteria is that Helicobacter can survive in the very, very low pH of the stomach acid. Um, Helicobacter pylori can sort of raise its own pH around it by excreting the enzyme urease, which will increase the pH from that very, very low acid that's in the stomach acid. And one of the things I think is really interesting about this, um, for a long time, they used to think that um, ulcers were just degradation of the stomach and the tissue of the stomach, and it was generally treated by um, surgery and then putting people on very soft and mild diets. Um, I know my father had to uh, have a lot of milk because they thought it would calm his stomach down. Um, and at the time my father had his surgery, they didn't know that it was an infectious disease, and so they basically cut out 3/4 of his stomach. So my father was quite thin because he didn't have a stomach. Um, and nowadays it would be treated with antibiotics first, and surgery would be saved as kind of a last resort. Okay. A few more gastroenteritis things. Um, Vibrio uh, paralyticus um, is found primarily in seafoods, um, and this is why seafoods are only you can only catch certain fish in certain times of the year because they are could be contaminated with the Vibrio, and we sort of know when the Vibrio outbreaks take place, so that if you eat certainly shellfish, um, you eat them in the right part of the year. Vibrio vinicasis uh, is infected oysters and clams. Bacillus cereus is a spore-forming bacteria which can cause a number of different food poisonings. Um, they're going to be the basic food poisoning uh, symptoms, though. Um, Bacillus cereus can infect very dry things like rice, and Yersinia endocollosis, a fever, diarrhea, and abdominal pain. Okay, soil-borne diseases, and these are going to be things that form spores. So among the most dangerous is anthrax, which is caused by the spores of Bacillus anthracis. This is a spore-forming gram-positive bacteria, and it is spread by aerosol inhalation of the spores. Now, that would be inhalation anthrax. You can also have ingestion uh, anthrax, where you would actually be eating the spores. And we can also have cutaneous anthrax, where the spores would enter an open wound in the skin. Um, the spores will germinate, and the vegetative cells will make a very fatal toxin. And signs and symptoms of anthrax: uh, organs fill with a black liquid fluid, and you get a black, crusty, boil-like lesion. Um, and there's a picture of a anthrax lesion. Okay. You have a very violent dysentery with bloody stools, and it is frequently fatal. Okay, you can use antibiotics to try to treat this. At tetanus, caused by Clostridium tetani, and again, spore-forming obligate anaerobe. You can get it from various sources in the environment. Um, Mostly, we are thinking about soil that's been contaminated, and the three examples there are contaminated nail, a piece of glass, or dirty nails. Um, that's how it's most likely spread, so that the nail or the piece of glass is contaminated with soil that has the spores on it, and then you step on the glass or step on the nail, and those spores get into your skin because it the glass or the nail will pierce the skin. Okay. Um, it definitely also can be um, from sort of more natural, that a thorn, like on a rose bush, can cause the skin injury, which will get the spores again into the body. Okay. Um, just like the anthrax, the spores are going to germinate under the skin, and your vegetative cells from the spore are going to produce a tetanus toxin. Uh, the toxin will produce a rigid paralysis and often lead to death. In this case, um, you get basically all your muscles will contract until you can't breathe properly, which will lead to death. There is a toxoid vaccine, um, but again, it's probably not something that's a kind of generalized vaccine that's given out to people. Um, you has to be kind of specialized to actually need that vaccine. Gas gangrene is caused by Clostridium perfringens. Uh, Again, a spore-forming obligate anaerobe. The spores germinate inside of your tissues, and the vegetative cells uh, ferment muscle carbohydrates, and so that's where you're producing the gas from uh, the uh, from the digestion of the fermentation of the carbohydrates, um, and you produce a huge amount of gas, um, which will end up tearing the tissues apart. Signs and symptoms of gas gangrene: intestinal pain at the wound, swelling at the wound, extremely foul odor, and the site turns dull red, then green, and finally blue-black. And you can see it there um, on that person's fingers that they're, that's the actual tissue that has turned black from the infection. So you can treat with antibiotics, and a doctor can remove the dead skin, and you can also use a hyperbaric chamber, so you're increasing the amount of oxygen around, um, and like it says that Clostridium perfringens is an obligate anaerobe, which means it only grows in anaerobic conditions. So if you force your body to have more oxygen, you hopefully will kill some of the bacteria. Okay. Arthropod bacterial diseases. What the bugs bite. Okay. Plague is caused by the bacteria Yersinia pestis and is generally transmitted by infected fleas. Okay. And So an infected rat gets bitten by the fleas, and then the fleas would bite the person, um, and uh, the fleas will regurgitate the bacteria while they're taking their next blood meal from the people. Um, so that will get the bacteria into you as the flea is trying to get a blood meal from you. Okay. We have two human forms of plague: bubonic plague, which is transmitted by the bite of an infected flea, and we also have pneumonia plague, where the bacteria are inhaled from the coughing of an infected person. Okay. So you can see that because the pneumonic plague uh, is airborne, and again, the airborne diseases are very easy to spread, uh, we don't have to have that many flea bites and still get plague in the area because not every case of the plague is going to be bubonic plague. Okay, signs and symptoms of plague: um, grossly swollen blue-black lymph nodes, uh, most people die of bubonic plague, and it is endemic in the prairie dogs of and some other wildlife. Um, Prairie dogs, especially in the Four Corners region of the United States. Tularemia. Tularemia is also called rabbit fever, and is caused by the bacteria Francisella tularensis, and again transmitted from the blood of infected animals through cuts in the skin. Antibiotics are available for Francisella. Okay. Lyme disease is caused by the bacteria Borrelia burgdorferi, and it is transmitted by the bite uh, of an infected deer tick. And very often you will get a bullseye rash. And so if you ever get a rash that looks like it's circular, like it's a bullseye, um, get that checked right away by a doctor. Okay. Um, Now, if you leave it untreated, the results are severe, potentially chronic joint pain, and the Borrelia burgdorferi actually likes to go into joints, and so it'll give you an arthritis. Um, it's sort of common in pets, especially larger breed dogs, um, that they'll get an arthritis, which is due to being bit by um, the, the tick, and the bacteria gets into the dog. Okay. Definitely can be treated with antibiotics. Rocky Mountain spotted fever. Now the causative agent is Rickettsia rickettsii, and again transmitted by the bite of an infected tick. Signs and symptoms of Rocky Mountain spotted fever are high fever for many days, pink spots and rash um, that develop um, on the extremities, uh, and your rash is going to start on your palms and the soles of the feet, and then spread to your trunk. Okay, this again can be treated with antibiotics. Sexually transmitted diseases. Um, so this is a sort of an interesting um, uh, table. It tells you the number of cases, and if you look at that, that's in the thousands. Okay, so chlamydia, gonorrhea, and syphilis are the three most popular of those diseases, um, and you'll see that uh, some of those chlamydia and gonorrhea are way more cases than a food poisoning like salmonellosis. Okay, um, and so uh, the chlamydia and gonorrhea are a really huge problem because very, very, uh, very high incidence of the disease. So syphilis is caused by the spirochete Trypsimonas pallidum, and the cells are able to penetrate the skin and cause the disease. There are three stages of syphilis. The primary syphilis, um, during primary syphilis, you'll get cankers, um, and this usually disappears in 2 to 6 weeks. In secondary syphilis, now you get systematic lesions, fever, and a rash, and partial loss of the hair on your head. Tertiary syphilis, you get aguma, and you get paralysis, and you very often go insane in tertiary syphilis. Okay, syphilis can be treated with antibiotics. Penicillin is effective against primary and secondary. Uh, it's usually too late by the time you get to tertiary syphilis. Gonorrhea, caused by Neisseria gonorrhoeae, and can cause pelvic inflammatory disease and sterility. Treatment again with antibiotics. And you can see that that's a sort of running uh, a running theme that all these bacterial diseases are treated with antibiotics. Okay. Chlamydia, uh, Chlamydia trachomonas is a causative agent. Uh, Frequently, there are no signs of infection in the males, and that's one of the reasons why there's so many cases of it, is because males aren't, they have no symptoms, so they're not being protecting, they're not protective and protecting their partners, um, and they're transmitting the disease. Female signs and symptoms, uh, a slight vaginal discharge, inflammation of the cervix, and a burning sensation during urination. Uh, and chlamydia can result in the scarring of the fallopian tubes, which can cause sterility. Contact and miscellaneous bacterial diseases. Here we need for our skins to touch. Leprosy, okay, which is also known as Hansen's disease, is caused by the Mycobacterium leprae. Again, an acid-fast bacteria, um, and is very resistant to desiccation, so it's very hard to get it to dry out. Okay. It is spread by multiple skin contacts or aerosol droplets. Signs and symptoms of leprosy: disfigured skin and bones, twisted legs, curled fingers, loss of sensation in extremities, and loss of extremities. Staphylococcal skin diseases caused by Staphylococcus aureus. These appear as boils, carboils, um, carbuncles. Um, so, uh, skin lesions, bumps, um, boils, raised areas of skin. And we can have abscesses. It's spread by skin-to-skin contact. Um, one of the most abundant forms is MRSA, or methicillin-resistant Staphylococcus aureus. Um, I know some people just like saying MRSA. I I actually like it to be actually, say what the MRSA stands for, methicillin-resistant Staphylococcus aureus. Uh, this can also, for toxic shock syndrome, um, we can get pink eye, uh, conjunctivitis, uh, caused by many different bacteria, including Staphylococci, and this is always spread by aerosol droplets from very close contact between people. And there is effective antibiotic therapy for pink eye. Uh, Trichomona, Chlamydia trachomonas, spread by contaminated fingers, towels, etc. So, um, you know, probably in a locker room would be some place where uh, the wetness will keep the bacteria alive, and there could be some sharing of something like towels or some equipment. Um, okay. uh, Leprospirosis. Leprospirosis interrogans is responsible for the most common uh, zoonotic disease in the world. Zoonotic means that it's an animal-borne disease. Okay. And here it is uh, transmitted from contact with the infected animal or their contaminated water. Um, Dental disease, dental caries are primarily caused by Streptococcus mutans, um, and that is just sort of a part of the normal oral microbiota. So that's why you have to brush your teeth, um, because that bacteria is supposed to be in your mouth. Um, if you brush your teeth to remove the number of Streptococcus mutans, you can get a lot uh, fewer cavities. Okay. And what's happening is that the Streptococcus mutans will ferment some of the sugars, and as it ferments, it's producing acid, and acid will break down the enamel onto surface. That's why you get the holes in your teeth. Uh, and effective prophylaxis is the best treatment. So, in other words, brushing your teeth fairly often. Okay. Um, so, brush your teeth and go to the dentist regularly. Periodontal disease, gingivitis. Here's where you're starting to get infections in the gums, um, cause a lot of bleeding. A number of bacteria can be responsible for that. Um, Some of the spirochetes are very dangerous, and basically the bacteria will just hide out on the roots of the tooth and just climb up the root to get higher up into the gums, so it can cause more damage. Urinary tract infections, or UTIs, um, are associated with normal gastrointestinal residence of the urogenital tract, and like I said before, um, or this is another example of where the sort of normal flora of the urogenital system is causing the disease. Okay. Um, and so bacteria enter through the urethra and migrate to the bladder, um, ureters, and to the kidneys. Uh, it is more common in women than men. Uh, Typical signs and symptoms: abdominal discomfort, burning and pain on urination, and frequent urges to urinate. Uh, can be caused by Staphylococcus um, Staphylococcus, Streptococcus, and Escherichia coli. Healthcare associated infections. Um, so, whenever you have an infection inside of a hospital, that's a nosocomial infection. And um, this is an infection that you get because of you're in a healthcare situation. The common bacterial agents are Acinetobacter, Clostridium, and methicillin-resistant Staphylococcus aureus. Okay, and those are all bacteria that survive quite well. Say if you're in an exam room, um, those bacteria could uh, exist on the exam table. Okay. Now, methicillin resistance is obviously already a problem with the MRSA, but we're getting a lot of antibiotic resistance of the organisms that are causing this disease. Okay. So, Klebsiella is one of the bacteria that can cause this. Um, in terms of prevention, wash your hands and surface decontamination. Um, so, in a doctor's office, you're probably not going to be able to decontaminate, say, a bench, but you certainly can wash your hands, and you'll notice that most places have uh, hand sanitizer in doctor's offices so that you can sanitize your hands so you don't transmit something that you picked up into your mouth. Okay, so what we should have learned from this lesson: the major airborne diseases, the foodborne and waterborne bacterial diseases, the soil-borne spore formers, the arthropod bacterial diseases, the major sexually transmitted bacterial diseases, contact and miscellaneous diseases of the skin and urinary tract, the agent responsible for healthcare associated infections. Um, and so, uh, again, as a thought question, identify the different ways that human bacterial diseases can be transmitted. All right, thank you.